Today I want to focus on a type of conventional cancer therapy that often instills fear in mostly women, because women are generally the recipient of hormone therapy. If you have been diagnosed with a cancer that is hormone receptor positive, that's the terminology used, then hormone therapy is going to be recommended down the line. So let's focus a little bit on that, what that means and how you could potentially get ready for that. Because in the end, you are the driver of your cancer care and you need to make the decision which type of treatment you want to have done to you. I'm Kirstin Nussgruber from Kirstin'sCancerCare.com, and I help people get out of cancer overwhelm by teaching them how to reclaim their lives. I'm a cancer survivor myself, and I walk the talk. I will forever remain in the shadows of cancer because we do. Once we are cancer survivors, even if we are thrivers, we still always need to be mindful with our nutrition and lifestyle choices, and we can do a lot to support ourselves and also to support conventional cancer care and any kind of integrative alternative cancer therapies that we are also embracing. So let's focus on hormone therapy. Most of my women clients kind of can make peace with chemotherapy or radiation therapy, but when it comes to hormone therapy, there is a huge fear associated with that. And to a degree, quite rightly so, because hormone therapies are usually given once the initial therapies are over, such as surgery or chemotherapy or radiation therapy. Then you're kind of in the long haul. What can we do conventionally now that could prevent a recurrence from happening or even metastatic cancer from developing? That is when we still have cancer cells in our bodies that have escaped the previous treatments and can travel and sit down and nestle in other organs. And suddenly what you had originally being a breast cancer can now become a lung cancer or liver cancer or brain cancer or even a leukemia, blood cancer or lymphoma, lymphatic system cancer. So that's the goal of cancer treatments per se, whether it's conventional only, whether it's alternative, or whether it's a combination of both, a so-called integrative approach. Now, what we are looking for is how can we most effectively target cancer cells, and is there a treatment that will really zone in on these types of cancer cells that I have been diagnosed with? And that's where hormone therapy comes in. So when you are offered hormone therapy, that means that your cancer is driven by hormones. It uses hormones to grow, to replicate, to infiltrate the tissue surrounding it, and to possibly travel and metastasize elsewhere. So from a treatment point of view, that's actually good news because it means you know exactly what drives your cancer cell, and there is a very targeted set of treatments for that lumped under the name hormone therapy. There are different types of hormone therapies. Hormone therapies are then given over an extended period of time, and that's where the fear often comes in, because when you hear that you're supposed to undergo hormone therapy for 5 or even 10 years post-diagnosis, that's a very scary time frame. In addition, when you hear that your hormones are being suppressed and you will have side effects for this amount of time, again, that's where the fear and the mistrust and the hesitation comes up, and that is totally understandable. So let me just clarify the two different directions of hormone therapies that we're looking at. So if you are premenopausal as a woman, meaning that you are still menstruating, in other words, your body is still producing estrogen, you will be offered the pathway of, they're collectively called SERMs, SERMSs. Those are selective estrogen receptor modulators. And what they do, what this type of hormone therapy does, and you know it from brand names like tamoxifen or raloxifene, and quickly here, we have generic terms and we have brand names. So when we say tamoxifen, that's generally a generic term. You will find certain medication names that don't sound like tamoxifen, but they fall within the tamoxifen group. And you can always ask your oncologist, and generally they will explain to you which path you're going on, and sometimes they simply won't, because they don't realize that you might want to know exactly which path you're on. And that's why I'm here to help explain this for you today. So if we are on the SERM path, selective estrogen receptor modulators, the name already says it here, is what you're trying to do is you're trying to prevent estrogen from attaching to estrogen receptors, because that's what your type of cancer cell is showing. It's showing that it has receptors on its cell membrane that can capture estrogen and use that as fuel for growth. So you want to prevent that from happening. Now, we have estrogen receptors not just in our breast tissue. We have it in our uterus. We have it in our ovaries as well. We have it even in our brain. We have it in our adrenal glands. So we have estrogen receptors elsewhere in the body as well, including in our joints and ligaments too. So when we block estrogen from attaching to estrogen receptors, we are also per se shutting off the beneficial properties that estrogen has. Bone density is important, bone health in general, but also ligament and joint health, heart health, brain health even. So estrogen, even though we think of estrogen as the enemy because it's driving my cancer cells, but estrogen is actually a positive hormone for us as well. So when we're blocking estrogen from attaching to receptors, we could have side effects. Now with the serums, like tamoxifen, for example, what happens is they selectively modulate these estrogen receptor activity, which means that some estrogen receptors in your body can still function. So if you are targeting, for example, breast tissue or uterine tissue, or even prostate tissue sometimes as well. When we go the other path, when we go the path of you are post-menopausal, meaning you do not ovulate anymore, you do not menstruate anymore, your body is theoretically not producing estrogen from those types of tissues anymore, a different approach is taken up when it comes to hormone therapy. You may have heard of the word aromatase inhibitors. That's a type of therapy that blocks a particular enzyme called aromatase, which we have in estrogen producing cells. So that's an enzyme that we have in tissue. It's not in our blood. We can't measure for that. It's in our tissue that produce estrogen. Again, that would be breast, that can be ovaries, uterus, prostate gland, brain, and even fat tissue as well. This particular enzyme. So what does this enzyme do? This enzyme aromatase, it converts a different hormone, testosterone, into a type of estrogen, namely estradiol, that is very active. That's the most metabolically active category of estrogen that we have, and we see that driving cancer growth prolifically. So we want to try and prevent this conversion happening. So we want to block this particular enzyme, and that's what the aromatase inhibitors do. Again, we have brand names here. So generic names are anastrozole, brand name would be Arimidex. We have letrozole, Femra, you might hear that. Aromacin belongs to the exemestane group. So again, different medications will be prescribed, but they all fall under the umbrella name of aromatase inhibitors. So this enzyme, by the way, this aromatase enzyme, which we all have, it becomes more active as we age and with increasing body weight. That's the one that is active in our fat cells. And that's why if we are overweight as a woman and we have any issue going on with a hormone receptor positive cancer, it is absolutely important that we lose weight. We focus on that. All right. So now we are blocking an enzyme that converts testosterone into a metabolically active form of estrogen. That doesn't selectively modulate anything like the serums, like tamoxifen does. So the side effects are a little bit more severe when it comes to aromatase inhibitor therapy because it blocks all estrogen. All right. So we're going to start seeing issues with bone density and our bone health. We might have joint pain, ligament pain. So we could have side effects from this that are pretty intense and lingering. And that's again, when we hear that and we hear that we're supposed to do this for 5 or 10 years, that can be pretty scary. What can we do about hormone therapy? So first and foremost, let's take one step back again and keep the perspective here. Very important. This is a type of therapy that targets what fuels and drives our cancer growth. It is 100% effective in reducing, blocking estrogen or blocking estrogen conversion. That we do know. I often get asked, can we take natural aromatase inhibitors? Are there natural aromatase inhibitors, for example, if we're going down that path, aromatase inhibitor path? Can we take certain supplements? And the answer is yes, we do. We have a plethora of these agents available, but let's understand this. They are about 30 to 50% effective as opposed to 100% effectiveness when it comes to these actual prescription therapies. So let's just understand that too, all right? We can take those supplements in conjunction with the therapies, and some of them can make them more effective or enhance their overall activity and maybe reduce some of the side effects. That really also depends on the individual and the individual load that we have. Remember, when we have an excess of estrogen in our bodies too, which is dangerous, we want to support our liver in clearing excess estrogen, because estrogen needs to be cleared from the body. And we may have issues with that even prior to even any kind of cancer diagnosis. So kind of we want to know beforehand, this is a prevention tip here, is our body effectively clearing estrogen? Our microbiome plays a very important role here too. Do we have a healthy gut? Because it plays a very important role in clearing toxins, including excess hormones that could potentially lead to a possibly hormone receptor positive cancer or could fuel that process. So liver health is very important. Can the liver effectively clear toxins, including excess estrogen? And microbiome as well, our gut health. We need to focus on that too. So those are two very important functions that we need to look at anyway. All right, whether we've been diagnosed with cancer or not, but our bodies are subjected to so much stuff from the environment, from what we eat. Can we effectively get rid of it? We don't want to include a toxic load. Also, we need to be mindful where in our products that we're applying to ourselves, in our cleaning products, in our cosmetic products, in our body care products, there are actually artificial chemical ingredients that have estrogenic effects, mildly so. But do you want to run the risk of adding to your hormone burden on a very regular basis when the majority, for example, of breast cancers that are diagnosed, and 1 in 8 women will be diagnosed or are currently diagnosed with breast cancer, are estrogen receptor positive, are hormonally driven? Not all of them are, all right? Let's understand that too, but the majority are. So what can we do naturally to get ready for hormone therapy? Number one, you want to make the decision for yourself. This is a tool that is available to you to prevent a recurrence, which means a local recurrence, but it also means a metastatic recurrence, meaning somewhere else in the body. And when that happens, that is so much more difficult to treat conventionally as well. And overall, it's much more of a challenge to deal with. So if we can prevent that, if we have a tool here where we know that is definitely blocking what is fueling my cancer, make that decision for yourself. Do I want to go down that path, or do I want to do it in a different way? And can I live with the consequences of that? Is it not going to run around in my mind the whole time? I'm not doing everything. I'm not doing everything. And that's a very important and very personal choice. It's a choice that only you can make, because in the end, you need to cope. You've had cancer, you've had certain treatments, you need to make this decision moving forward. This is your life. And we can, everyone, your oncologist, radiologist, anyone, your family, your friends, other practitioners like myself, we can guide you, we can give you this information, but ultimately it's your decision, and you need to go to sleep at night and have a restful sleep, knowing that the decision that you took is the best for you, the best that you could take. So, there are certain supplements, absolutely. And supplements to me, when it comes to cancer care, this is a type of nutraceutical therapy. This is not just taking a supplement because I'm low in vitamin B12, which you can measure. This is trying to influence the biochemical environment in your body to make the chance that cancer can grow and recur less, reduce that, but also to make the treatments that you're receiving, the conventional treatments that you're receiving, more effective. And there is a lot we can do. You will feel better, you can have reduced side effects, you can make the treatment more effective. So isn't that your goal? Isn't that the reason why you will decide, I'm going to go for this particular type of treatment? So if you have an opportunity to enhance that, it's up to you to go for that. First of all, when we are on aromatase inhibitors, remember we're shutting down estrogen here. We need to look at our bone health. So make sure we focus on bone health. Our mineral content is very, very, very important here. We need to keep an eye on it. We need to do bone DEXA scans, density DEXA scans as well, to get a baseline and understand where do we lie. If we already have osteoporosis or osteopenia developing, or it's already evident, we even need to be more vigilant with this. Make sure that we get enough minerals, including calcium, and then make sure that that calcium gets deposited in the bones and doesn't stay in the veins where it could calcify. And that's another important part. We need to make sure that our vitamin K levels are adequate, our vitamin D levels are adequate. And vitamin D here is very important for us cancer survivors. It needs to be really up there, all right, when we measure our levels. So make sure that you have an integrative approach when it comes to that, and not just a standard conventional approach, because those levels of vitamin D are generally not sufficient. So you want to be in the 60s and the 70s when it comes to your vitamin D levels, all right, just to make sure that you aren't using all the positive properties of vitamin D. Very important for bone health here too. Mushrooms. Medicinal mushrooms are actually natural aromatase inhibitors. There are polysaccharides in them, which can enhance aromatase inhibitors and just overall enhance the activity of blocking this aromatase enzyme that will convert testosterone to estradiol, right? Then a particular group in the vitamin E is tocotrienols. It's a particular group of vitamin E. And that too, those two are natural aromatase inhibitors. So that's something else that we will look at when I put together a supplement regimen for you. Then we can do certain other things. Calcium D-glucarate, by the way, speaking of calcium. Now, calcium D-glucarate is a type of calcium. It's actually a calcium salt of a natural acid that is produced in your body. And what that does, it blocks another enzyme, beta-glucuronidase. That enzyme would prevent your body from effectively detoxifying from waste material, from toxins, including excess hormones like estrogen, for example. So what we want to do is we want to stop this enzyme from doing its activity, all right? Because we want our bodies to be able to clear excess estrogen from our bodies and other waste products as well. So calcium D-glucarate is a very important supplement that we can add to our protocol as well. Then there is movement. We're going to experience certain joint pain, stiffness, ligament stiffness while we're on aromatase inhibitors in particular, but tamoxifen as well. Movement, stretch movement, yoga, tai chi, pilates, walking, stretching. So stay active, keep those joints moving, all right? Acupuncture is another very, very helpful tool to deal with the side effects that we can experience when we are going through hormone therapy. And then really also remember, there is certain flexibility here. I've had many clients who started with certain hormone therapies, stopped because they couldn't tolerate the side effects, or jumped maybe from aromatase inhibitors to tamoxifen, even though they are postmenopausal. This, of course, all in conjunction with their oncologist. But I want you to walk away from this knowing that you have options. You can titrate the dosage of your aromatase inhibitors, and very often that will help too. So you put on a particular dosage, you're experiencing all these side effects, and very often the oncologist isn't even aware of it because you don't necessarily see that person, that particular doctor, on a regular basis. You can have a discussion with them saying, can we reduce my dosage? Because I'm going to be taking natural aromatase inhibitors as well. I'm on this particular supplement program. Here it is. We share with oncologists what it is. Can we see if that has an effect? Can we try this? I want to stay on hormone therapy. I don't want to jump completely off it, but I want to make it more tolerable. And then there are other women clients of mine that are absolutely fine because they're already leading pretty active lives. They're already on supplement protocols. They're already eating healthily, and they can tolerate the dosage of hormone therapy that has been prescribed to them. So it really always depends on you. Just understand that we are flexible and we change and we adapt, and we just need to look at the overall picture as well. And there's always a little bit of flexibility there. So I hope this has given you a bit of an insight how to get ready for hormone therapy, and the decision is yours. It is a tool in conventional cancer care, and just as with everything in conventional cancer care, there's a lot we can do around it as well to make sure that we tolerate it better and that we understand what it does to our bodies. Ask questions, get an explanation, get things in writing. If they want to propose a certain hormone therapy and it's just too overwhelming for you while you're sitting in the office, ask for it on a piece of paper. What type of hormone therapy are they recommending for you? So you can go back home and just sit and mull over it and understand which path you're being put on. At Kirstin'sCancerCare.com, which is my website, I share a lot more tips. I share recipes as well. You could also schedule a free assessment call, a 15-minute assessment call with me to see if you would like to be coached by me. I work with clients over an extended period of time, and we drill into the details. We help you cope. We help you understand what you can do nutritionally and lifestyle-wise, and how you can cope with yourself, with your cancer care journey, how you can turn into this overwhelmed cancer patient and emerge as a thriving survivor, and how you can make peace with the process along the way as well, even if that sounds really crazy to you, but that can be achieved. It actually can be achieved. Just know that you can do it. I'd love to see you there. Again, it's Kirstin'sCancerCare.com, and I'm going to post the link in the comment section after I've done talking with you. So take care for now, and good luck with your own cancer journey.